Thank you, Mr. Chairman. And Mr. Neal, thank you for our opportunity to speak prior to this hearing. I share the deep concern expressed about Health and Human Services submitting an operating plan, otherwise known as a spend plan, to Congress that includes asterisks rather than planned funding levels for over 530 different programs. This is effectively the Department of Health and Human Services saying that it doesn't need to tell Congress and the American taxpayers how it is spending tens of billions of dollars. With that, we are left to assume that the Department of Health and Human Services is intentionally hiding what it's doing, and the results of a massive proposed reorganization, firing of tens of thousands of employees, terminating billions of dollars in grants, and actively delaying billions of dollars in funding. During our meeting, we discussed the importance of transparency. Secretary Kennedy has pledged what he called radical transparency, and that is absolutely not what we have seen. So, Mr. O'Neill, do you think that the Department of Health and Human Services should tell Congress and the American public how it is spending taxpayer dollars that we have already appropriated? Yes or no?
Thank you for the question, Senator. I also enjoyed our meeting. So I've not seen this this plan that you're referring to with the asterisks.
I can tell you that it was a long page, asterisk, asterisk, asterisk. No dollar amount, except for a handful of programs. That is not radical transparency in my book. Should the Department of Health and Human Services tell Congress and the American public if it is, for example, cutting funding for services through the 988 Suicide and Crisis Lifeline? Yes or no?
Senator, I'm a former Senate staffer. I know that it's Congress that authorizes all the programs at HHS. It's Congress that appropriates the money for HHS. Congress absolutely deserves prompt and transparent and accurate information. I stress the prompt part.
And what about how many employees have been fired and the functions that those employees were carrying out? Should that be reported to Congress and the American taxpayers?
Senator, my understanding of the RIF is that it was the decisions of who to lay off were, I think I read, made by the heads of the operating divisions who are close.
Should that be reported to Congress?
Senator, yes, I think so.
Okay. Should the Department of Health and Human Services tell Congress if it fired, for example, employees administering clinical trials at NIH's clinical center? Yes or no?
Senator, I think every significant thing the department does should be available to Congress.
So, Mr. O'Neill, if you are confirmed, I will certainly be following up to ensure that Health and Human Services makes good on the commitment to transparency. And if these changes would actually enhance the health and well-being of Americans, HHS should be eager to explain how and why, instead of what it's doing, which is hiding this information. HHS has delayed funding for research on treatments for deadly diseases and for Head Start and child care programs. It's decimated offices responsible for carrying out critical activities, including addressing lead poisoning in children. And let me just give you an example of how HHS firings are impacting communities in Wisconsin. The city of Milwaukee requested assistance through the CDC's Childhood Lead Poisoning Prevention Surveillance Branch to help respond to lead poisoning cases tied to several public school facilities. The request for assistance was denied because of a lack of staff capacity after the entire childhood lead poisoning branch was fired. This is a clear example of HHS firing affecting critical program operations. And without this support, Milwaukee faces lasting implications of health and well-being of children in the city. If you are confirmed, I will be following up with you on this, as I have yet to receive a response from Secretary Kennedy.